the Society for Innovation and Entrepreneurship, or SINE at IIT Bombay, is one of India's oldest and most trusted startup incubators. For over 20 years, SINE has helped young founders turn bold ideas into real businesses. As part of the SINE Startup Founder Series, MyStartupTV had the opportunity to meet some amazing entrepreneurs rising from this vibrant ecosystem. Today, on the SINE Startup Founder Series, MyStartupTV hosted Dr. Nisha Yadav, who's the co-founder and director of EDHAA Innovations Private Limited. We began our conversation by asking what her startup does and the business they are building.
So Idha is basically a Sanskrit word. It has a beautiful meanings. So the one name this name suggests it's a name of Goddess Saraswati, or a goddess of learning. It also means happiness and prosperity. So this EDHAA Innovation is founded by two ladies, two women, and we are PhDs, doctors. I have done PhD in pharmaceutical sciences, nanotechnology. So when we two techies are, who are worshippers of Saraswati, establishing a company for happiness and prosperity of the society, I think Idha is the best name which we selected for this company. So that's what it started with. It develops develop unique, innovative products related to healthcare. We have been associated with healthcare domain since last almost 15 years, and our aim was that in the era of convenience, information, digital technology, where do we stand within healthcare? How much do we know actually about health, our health status? So when we started talking to the people, clinicians, doctors, patients, n number of people around it, almost hundreds of doctors we talked to pan-India, we realized that still the diagnostic technology is limited to one, or we would probably call it a centralized system. Samples being collected to different location and then tested at under one roof. So there is a need for democratization or making this diagnostic technology more accessible. Okay, so if I can book or order a food at home, and when I order a test, person come and collect the sample, then there is an anxiety. What next? What will be my report? What will be the next thing which I can do? So which doctor to talk to? So all these things lays a lot of anxiety and timely process it is. So what we do, we have come up with a solutions, a portable diagnostic devices or the solution device which can just connect to your era of digital, right? Just connect to your phone, you put the sample, you will get the results, and this result directly go to the doctor based on your test results, which doctor fits best for you, that is recommended, and then you can just contact to, and you know exactly what is wrong with you and what is the next step. So that is how we are trying to get diagnostics and further management at a convenience of patient. First and foremost, yes, I totally agree. It's a totally different domain and different game altogether. Technical knowledge or working in the lab, developing product, I believe is something a different challenges. But entrepreneurship brings your own challenges and an unknown territory, especially for first generation entrepreneurs. But I believe that the one thing that is common is resilience. Scientists never give up. They never, stop taking challenges. They try until they succeed. I think entrepreneurship is also about it, trying to understand your customer, trying to understand the market need, trying to understand the problems in your team, rest of the things. So I think that was the connection. And with respect to how we started, I think the first and very foremost thing that I don't think so there is anyone in this world who is completely fit, doesn't need any healthcare solution. So we have been obviously working in the healthcare domain, we have been identifying the issues around it, and some of our personal experiences, like, I'm a first-time mother and my co-founder is also. So during pregnancy, we had certain experiences we identified, and we came to know that if I am a educated woman, I have resources around me, if I can face these challenges, there may be n number of women who are undergoing these kind of challenges. What can we do about it? We just cannot sit there and just live with this problem. Let's do something around it and try to change the scenario. And with that aim, we both started working on the identifying the problem, talking to the doctors, and then that's how it started. So obviously, but it was totally an unknown and very terrifying thing to enter into entrepreneurship. Well, our family reaction was like, why do you want to? And many women are judged. Like, why do you want to go to this kind of terrain which is male dominated and lot of challenges? But I think the motivation of bringing the change and not seeing women suffering more because of something which can be solved was the main motivating factor. You know what? Before I answer your question, I'll just tell you that what is the most frightening thing whenever you're going in any unknown journey or anything? It's like not knowing the terrain. That is the main challenge. So in healthcare, this is exactly what happens when I'm not aware of what is going wrong in my body and what it can lead to. That uncertainty and not being aware of the situation is going to cause a lot of problem, and that is basically we called as a complication which are preventable complication lead to almost, I will say, almost more than 45% of maternal death in India. And this is not just limited to rural or tier 2 tier 3 cities. It's all the scenario is same in the urban cities also. If female knows that okay fine I'm pregnant, but at the same time what next to be to done with my baby is growing proper or not, is there any kind of complications, until and unless a symptom shows in, she is not going to know about it. So that is the reason periodic checkups are being done. But as I said, these are currently limited to a certain centralized system. What we are trying to do is like when in a pregnancy situation, female less mobility, she want rest, she want convenience and all. So why not people coming to there? She should not be anxious. Then why how the testing can be made at her own doorstep, and she is aware of her situation, she can get a consultation from the doctor and a guidance around what next can be done. So I think that is how to making it more accessible and more evidence based management is, I think it's the key for this uncertain, conquer this uncertainty domain. So I think that is what we are trying to do is, so as I mentioned, to bring the diagnostic at a doorstep, we are coming up with a miniaturized diagnostic solution or devices which can perform the testing same as that of the lab grade or lab based system. At the convenience of the patient, the testing can be done. The results are available on the spot, and then digitally or remotely, the guidance or consultation can be made available to the patient and or the women. So I think that will help in taking a faster and evidence based decision. On a schematic way, if you say ask me, then yes, it's like we don't want it to be at home care or where a patient is doing it, because that is also in pregnancy that might add to the anxiety. What happens if she commits a mistake in doing it. So what we are not taking the control from the clinicians. What we are doing here is when a female enroll to a maternity home, and she enrolls for that whole gestational packages where she is supposed to visit the consultant for the consultation and testing and all. So there the hospitals, we are giving to the hospitals can make sure that the nurse or who's healthcare professional reaches to the female's home, and the way ASHA workers do in a rural setting. Yes. So here it is more, she is more empowered. So she is basically having these kind of devices. She can go to the women's place, can do the tests there, and can communicate the results to the doctors for the first awareness. So the female can avail the thing, and if anything is wrong is there, she will be able to manage certain conditions. At the same time, if she needs it, she can actually make it available for a better consultation and all that. So that is how it is done. So obviously when the person or the nurse is visiting the women home, there they will be able to do it like withdrawing the blood or the urine. It's just not blood, it's also the urine, the multiple tests. So that itself is a challenge, making one device which can perform testing for multiple biological fluids, we call it. So taking those samples, doing the tests and getting the results on the spot, digitally transferring it to the central location, to the patient mobile, to the caregiver, wherever you want it. And then accordingly, and at the same time, our solution or the software also gives you a risk score. The female is, in a good, very low risk score is there. It's very high risk score is there. So that kind of female need to be taken to the hospital or need to be taken for the further management at hospital settings. So that also helps in, giving you an evidence-based decision-making power.
So you're giving a run for the big diagnostic center?
No, absolutely not. It's not that actually. I think 2025 or even before that is an era of change also. Tell me, a few years back, how many were actually knowing about AI, ML and all? How many were actually? Have you ever thought of that we're going to be a cashless or UPI type of transaction? So we are adaptive, and I think diagnostic or healthcare industry is going to be also adaptive, because we are working with the hospitals. They are facilitating this patient side testing. So they know that this is.
So you're augmenting their business.
Yes. So it's going to be, if they can collect the blood, they are collecting it, right?
Yes.
Why can't they do it? No, patient will be more than happy to get the results on the spot and better patient satisfaction. So I think it's one more mode of making them increase their business or market penetration. In many tier 2, tier 3 city, they have just collection centers. They just collect the sample and get the sample, transport it. That adds to the cost. If they could do the testing then and there only on those locations, they need not spend on the transportation cost, because this blood sample need lot of logistics and cold chain requirements are there. Yes, because of the lot of initiative by the government in villages or in a rural location also, they are under a skill development plan.
Correct.
They are training the youth, or especially women's, for various technical jobs, especially blood withdrawal, phlebotomist and all that. So they are the manpower we can utilize in equipping or strengthening their healthcare system. At the same way, one more aspect of our technology is about the insurance companies who perform these health checkups, and where they go to the patient's home and they do the health checkups. And there are few tests which they do at home, and then otherwise they have to be dependent on the centralized location. I think that segment is also something where the health insurance company will be able to take faster decisions. Their operational efficiency will increase. So I'm giving you to broader picture, just not rural. That mindset should not be there. It's also about the urban market also, where this technology holds a lot of position or value. Okay, so Idha Innovation is developing a portable diagnostic platform which comprises of a hardware which can perform on-the-spot testing and reporting, but at the same time a software which have a capability of not just quantification but also risk stratification that helps in timely management and evidence-based decision making. So it will empower the healthcare ecosystems for a better decision making and for better outcome. So with that aim, we have been supported by various national and international organizations. We have been supported by almost all the government organizations, you can name it, DST, DBT, BIRAC. They have supported this under various programs, DST Nidhi Prayas, DST Seed Fund, DBT, BIRAC, Grand India Challenge, Gates Foundation has given the fund for the development. And we have been also supported by Indian Oil for development of the technology for their rural, or not rural, it's refinery hospital. So that we have already done. So almost 3 crores of funds we have raised through these various grants. We are already in the process of generating raising funds from some VC firms and angel investors. We are currently looking to raise around 10 CR of money for our technology, because it is already clinically validated and approved by regulatory bodies. What we are currently going for is for manufacturing capability building and then commercialization and marketing and sales workforce development. So with that aspect, we need to raise around 10 CR of current valuation of company is around 40 CR. So we raise around that much money from the investors. Next 5 years, so we will say that currently, since we call it as a TRL 6-7, so it's a technology readiness level. So 9 is the ultimate level where product is completely working fine and all that. So we are at that level where we are already, early traction is there, early customer is there who is using the technology or is paid customers. So in next 3 years, we aim to deploy at least, we have 2 different types of hardware. So we aim to deploy around 30 pieces of our first product that's called as BioCheck, in at least 3 states of in India, and almost 50 pieces of our another product in different pan-India refinery hospitals of IOCL and some other identified segments, which I won't be able to name it. So this is the number of units which we are to aim to, and around executing around 1 million tests is what we target in next 3 years. So that is what is our aim. And with respect to financial projections, which is done by the third party, looking at the market and the potential of the technology, we are looking at the valuation of around 100 CR. I think the role of SINE is almost the same as that of role of a parent in a child's early years of life. No, how they train you to walk and how they train you to face the situation and in any kind of complex situation. So SINE is the early believer. That is the reason. So that's why I really look at them like parents who are guiding you, who are guiding force, and they are always sometimes criticizing you also. So SINE, this IIT Bombay ecosystem has done wonders. This is like first believer we have got before even the idea was transformed into a product. So that was the thing. They are connecting us to a different ecosystem players, right from a regulatory expert, you call it, or business mentors, national, international, pushing us for the various exhibitions and expos where we could get a exposure of our companies is there, and the product exposure is there. So that is what these SINE. I think I will need another hour of talking about how SINE has contributed in our journey and how they are already. So they are already trying to understand, giving us exposure, and I think this kind of interaction is something which is very common for us because of SINE. It's like with respect to regulatory person, I'm talking the similar way. I'm business people. I don't even know that this could be the person who could be helpful. They identify and they tell us, why don't you talk to them? They will be definitely going to helpful for you. So I think their role for us is like a parent who is guiding force for us, and making our vision or a dream come true. Yes, I think if you will ask like 10, 15 years back, I think I'm not even 15, 10 years back when the startup, this world was not very much aware of this startup generation and all. It was something very problematic that, they could actually identify that where should, what the exposure, how they can get the exposure. Yesterday only I was talking to that era entrepreneur. But now I think a platform, a media house exclusively working to give us an exposure is something a boon for us, because if you'll talk about, let's in healthcare we call it as, if you talk about, let's in a simple language, let's talk about Amitabh Bachchan. He doesn't need a introduction, right? But Nawazuddin Siddiqui, he was a part of some background actor. He was, no one was aware of him, but now he doesn't need any kind of introduction. So I think those early days, if someone actually give you a chance to talk about your company, your product, is something which is really very important, because I can talk to one Mr. Shetty, but Mr. Shetty and his TV can actually talk to thousands and millions of followers or viewers who are following. So I think this kind of exposure I won't be able to get it without the media houses like you. So I think you guys are doing a great job. And it's also, no one actually talks, everyone talks about the incubator, the funding body and all that, but this kind of media houses should also be applauded for the kind of work you guys are doing it, because we as entrepreneurs need it. And the technical team and all those things, we do it. But this thing, the marketing and then actually making people aware of it, is something only you guys can do, and you guys are doing a fabulous job. So I really thank you for this opportunity.
To stay informed about the startup ecosystem, subscribe to My Startup TV.